All right. Well, good morning. It is wonderful to see each of you. It's been a while. We've had some committee meetings or other opportunities to connect, but it's really wonderful to see each of you this morning. So first, just want to start off by, thanking each of you for being a part of the conversation this morning. But also, over the last 4 months, when we think about the support you've given to the residents of Columbus, whether that be through your friends, your employees, your networks, your neighbors, your own family. I think really recognizing the last 4 months and what that's meant for each of us, and recognizing that the challenging times that we're in. And I think for each of us, that means a different space. Reflecting a lot on, for some, it's a time of listening and a time of learning, but also a time of contemplation, and a time of action. And I think with each of those places that we're each sitting also brings a lot of different emotions. We think about kind of the roller coaster, and I've been on, and I'm sure many of you, through times of sadness and grief, exhaustion. But I think also this time of optimism and hope when I think about the opportunities we have before us to make changes. So just wanted to start with that to really recognize each of us comes to this, the conversation from a different place and a different lens. And so offering up that space of respect and grace as we are in conversation together. So again, thank you for all of us being a part of the conversation this morning. The conversation this morning, we have kind of in 3 different sections, although it will really be a conversation throughout. Starting off with the time this morning with the mayor, who is with us for a time of dialogue and conversation. Then we're going to move into a space of learning. Sue Ellen Bennett, she is the new director of the Columbus Public Health Center for Innovation. It really came out of when the city recognized, racism as a public health issue. She's leading the new center. And so we thought an opportunity to learn from her center, what they're seeing about, COVID and the impact on women. And then the last part of the conversation, digging into more questions, for us as a group on what we're seeing, what we're hearing, and how does that impact what the commission can and should be doing here as a response in our community. So that's just kind of a walkthrough of our next hour and a half together. If you have any tech issues, put them in the chat box, or I think most of you have my cell phone number, since I will be able to check that easily. I'm getting used to this format here this morning. And, again, we'll have a lot of opportunity to open the line for questions and dialogue this morning, but don't hesitate to put questions in the chat box also. And we'll do our best to kind of honor and recognize the questions that are there. So with that, I will turn it over to Chair Shannon Ginther.
Good morning, everyone. So I'm going to just preface this by saying we have a tiny dog who is acting very big and barking a whole lot. So between myself and the mayor, who are both in the same house right now, you may hear the dog. 6 sounds of fierce bark. So thanks for being with us today. I know it's been many months since we were together, and it feels like the world has changed 180 degrees. A 50-year pandemic, racial unrest that we haven't seen since the 1960s, lots happening. And it's really easy to get discouraged, to think, that women and families, especially women and families of color, are falling farther behind based on everything that's happening in our world. And so I've been trying myself to think about ways to reframe, to quarantine the negativity, trust the process. And so this morning I opened up to a daily meditation book that I use called Journey to the Heart. If you haven't seen it, it's fantastic. And today's was so perfect that I thought I would just read it. Trust each step. Stay present for each step in your journey. We don't go from one place to another in a gigantic leap. We get there in increments by going through each feeling, each belief, each experience, one step at a time. Sometimes when we pray for miracles, what we're really praying for is help in skipping steps or shortcuts. The simple act of acceptance, of returning to each step of our path, can often bring us the miracle we need. Then we see the truth. The real miracle is one always available to each of us. It's the miracle of acceptance. We can go where we want to go, one step at a time. Stay present for each step of your journey. Trust each stage. Many things are possible for you if you accept that the fastest way is one step at a time. So again, it's so relevant for right now. We want to skip through this. We want to skip through kind of a lot of work that's very, very uncomfortable. And so what I would encourage us to do today and moving forward, as we have been doing, is one step at a time to support women and families in our community. And so we have today, as Shelley mentioned, the opportunity to be in conversation with the mayor, to talk as ambassadors for all women in this community and discuss what those incremental steps might be, as the administration considers its next steps, its policy agenda, things that we can do right now and moving forward for women and families in our community. So without any further delay, Mayor Andy Ginther.
Thank you, and thank you all for allowing me to join with you this morning in a conversation. It's great to be with you all, even albeit virtually, to see your faces and to engage in conversation this morning. So grateful for all that you've done thus far. I've said from the very beginning that the work of the Women's Commission is the heart and soul of our policy agenda as an administration. And it has never been more true as we laid out our equity agenda earlier this year. And so glad that Sue Ellens joined us here today. She gave us an update on some of the great work being done at Public Health at our last Celebrate One board meeting. And so look forward to hearing more from her and the team at CPH as we continue to delve into racism as a public health crisis. I think one thing that we can all agree on is that 2020 will be a year we never forget. A pandemic that has left us in a health crisis, human services crisis, and an economic crisis, plus the national movement and the most significant conversation about law enforcement, social justice, and racial justice probably since 1968. It's been exhausting and frankly frightening at times. Every single life has been disrupted to some degree. I want to share with you a little bit of a passage that my wife shared with me not too long ago, which gives us a different perspective of what 2020. I know that a lot of people have said what a negative year this has been, how awful this year has been. But I think of it in a different way because of the insight and thoughts from this passage. What if 2020 is the year we've been waiting for? A year so uncomfortable, so painful, so scary, so raw that it finally forces us to change and grow. That's by Leslie Dwight. And if you have an opportunity, I'd encourage you to read the whole thing. It's not too long. As you all know, in February, I rolled out my equity agenda at the city address at West High School. I called out racism and made a commitment to rooting it out and finding the disparities wherever we find them. Let me be clear. Racism and discrimination exists. It exists in the mayor's office and in each of your workplaces. We don't need to own racism and discrimination and its historic implications, but we do need to acknowledge it exists. And what is so important is that we need to own the remedy, the correction, the solution. Many people around the country about, racism and discrimination. I think there's a consensus there where the fight, where the battle, where the real hard work has to be made and sacrifices have to be made is in owning and implementing the remedy, the solution, the change. I always say that nothing threatens entitlement like remedy. Everything we've seen this year shines a light on the disparities in our community. Black and brown people are more likely to become infected with COVID-19 and suffer longer illnesses with more severe and significant complications. Black and brown people are more likely to suffer the economic consequences of this pandemic. And these inequities existed before COVID. Birth outcomes for Black babies still lag 2 times behind white babies in this community. Women, particularly Black women, make up a disproportionate number of evictions, impacting them and their families for decades. And Black women's equal pay day is August 13th. Let me repeat that. Black women's equal pay day is August 13th. Black Lives Matter. It's not a slogan, it's not a hashtag, that's the truth. And if the vision and spirit of the Women's Commission is to be fully realized, that must be the truth we seek. We do everything we are doing at the city, from hiring to awarding contracts to initiatives, through the lens of equity, not equality, equity. There's a difference. And I know that that is challenging for some in our community to hear, but it's our job to help them understand that we can't reach our full potential as a community unless everyone has the opportunity to thrive and succeed. And clearly, that is not happening. But we cannot do all the work alone. No one entity can, which is why your support and advocacy is more important than ever before. The Women's Commission has been absolutely critical to our top policy initiatives, and we would not be where we are today with respect to having an incredible court case before the 10th District Court of Appeals to potentially right a wrong decades in the making that has disproportionately negatively impacted Black women and families around evictions. You are ambassadors in our community, and the work you do has never been more important than it is right now. And I want to thank you for being advisors to me and to my thoughts on what you've seen and what you've heard over the last few months and how we can harness that into real, tangible change for all of the women in our city. Now it's time for me to shut up and take your questions and engage in conversation with you all about our path forward on this equity agenda. Thanks for having me.
Yeah, so we'll just really open it up. If folks have specific questions they'd like to engage in the mayor and get some thoughts around, or feel free to also use it as a time to share what you've seen and heard that we want to be sure the mayor's in conversation on.
Shelley, I have a question. Mayor Ginther, hi, I'm Veronica Knuth with Cover My Meds. And through all of this, starting with COVID, I have to wonder, as an employer, what can we do differently to really support the whole person and get more people into the workplace, quite frankly, more single moms into the workplace in a way that's highly supported, with daycare and some of the transportation and things like that. Any thoughts, or anybody in town doing it right?
Question, and I know this commission is working with some of our private sector and public sector employers about things that they can be doing. And I know I'm not as part of the agenda here today, Shelley, but I know Shelley and I talked before about putting together that framework and recommendations for employers, and having the private and higher ed and nonprofit sectors join us in endorsing those to their members and to their networks. One of the things that we're doing as a city, we received a significant amount of money for COVID response through the CARES Act earlier this year. And so we've really been trying to invest money into obviously the public health crisis, but also the human service crisis and the economic crisis that's ravaging so many families, disproportionately folks on the lower wage end and their families. And one of the things, to your point, specifically around childcare that we are proposing and working towards is supporting childcare centers, particularly those Title 20 centers and even some home providers that have been absolutely turned upside down based on COVID. The fact that childcare centers were closed for so long, the requirements and standards in place for them to reopen in the midst of this pandemic. And so what can we be doing as a city to support with CARES dollars those childcare that may not have reopened without our help and support? And we already know the critical shortage for high quality, affordable childcare in our community and in communities around the country. And so that's one of the things specifically we're looking at is how we help those home-based providers, those center providers that are attempting to reopen and that without our help and assistance may not have been able to make it work. There's been some money from the state, but as you know, the state of Ohio is a very big place with over 11 million people. And so that's what we're looking at. But I encourage you to help us figure out what the best way, so we can have the partnership and the chamber and Ohio State and some of our largest private sector, public higher ed employers endorse the recommendations from the commission. We can support women, being able to enter the workforce, but also help support their families.
Great, thank you.
And I think we are getting some feedback, and so we're just going to try to keep everybody muted unless it's at the time when you're speaking. We'll try to see if we can help the feedback. Thanks.
Hey, Mr. Mayor, it's Jeff Little. How are you?
Doing great, Jeff.
My question is about the digital divide, and so many Columbus City school families in particular wouldn't be able to join this call with us because they don't have access to the tools or the necessary Wi-Fi. And I know there's a great conversation going on in the community about this. What are your thoughts?
I think that this could be one of the greatest examples. I mean, there's so many examples, obviously, of life expectancy, health quality, quality of life, safety, housing. But this digital divide, I think, is one of the greatest examples of manifestations of inequity and disparity in our community. And so in conversation with Dr. Dixon at Columbus City Schools and the challenges that they have had, many of you may not know this, that after March, when schools were closed, Columbus City Schools didn't have contact with 1/3 of their families. No contact with 1/3 of their families. They weren't able to join Zoom calls or lessons and access things. Now they were, the school district did an incredible job getting out, thousands of Chromebooks, and then realized that, those Chromebooks weren't really effective unless they had Wi-Fi, and internet as part of it. And so, the number of hotspots and other equipped devices that they put out, but that's a great challenge for them right now. So I think there's two questions, Jeff. What do we do this school year right now to prepare for this school year so that we don't, continue to pour gasoline or an accelerant on inequity and disparity? Because we already know that happened between March and June for kids in Columbus City Schools and other public school districts in Franklin County, but Columbus specifically. And then what are we going to do about that starting in August, or in the case this year, they're going to be starting after Labor Day with in-person education 2 days a week for K through 8, but I think high school is going to be all virtual. And so what we're contemplating in the partnership that we've put together with Dr. Dixon in the city, again, is around CARES Act funding to help support that technical need, that gap, not just Chromebooks, but internet access. But the larger question is, how do we deal with this as a community? And I think this is an incredible opportunity for a public-private partnership. Another way, in the spirit of not just downtown redevelopment, economic development, revitalization of neighborhoods, Celebrate One. I think this is an incredible place for another P3 in this community, for us to really deal with a disparity and inequity that is rooted in racism and in discrimination. I mean, when you take a look at who has access and who doesn't, it's pretty clear cut. And so, shorter term solution for this school year and the coming academic year, but longer term, I think this is an incredible opportunity for the public, the private, our K through 12 and higher ed partners to come together to deal with this issue. This is doable. We can get this done. But there are some significant gaps in our community with respect to access to high-speed internet.
Mr. Mayor, if I could follow up on that, how are we measuring the impact though of that gap, and a third of students not being able to have contact with their schools? How are we tracking that? How are we measuring that? And then are there any plans to bring some more intensive support to try to mitigate the fallout from that impact beyond just improving technological access?
Yeah, it's a great question. I don't have an answer to you. I'm not an training or profession. I would defer to Dr. Dixon and her folks at the school district. We're all in partnering to help fund. I mean, I think what you're speaking to is enrichment and additional support, both academic and maybe also emotional mental health, because one of the big things that we're seeing is the impact on the mental health and emotional well-being of our young people during this pandemic. They have so fewer opportunities and outlets and opportunities for constructive activities. And that's why I was so adamant opening up our summer programming this summer, albeit very different, smaller groups that aren't interacting with other groups and doing all the things that Dr. Roberts has instructed us to do. But I knew for many of our kids, they had not interacted with other young people in months and had not been engaged in a whole lot of things that young people should be involved with, constructive, physical activity and other types of things. And so that's something that I'll be happy to follow up with Dr. Dixon on, because I think you're right. I think we will know, and my guess is the school district already knows, those kids that did not connect, weren't able to access any of the educational opportunities during the last couple of months of last school year, and what we can do for them, in addition to the summer programming and the other things that we're doing, help them caught up and back on track in the coming school year. But I'll be happy to talk to Dr. Dixon about that.
I have a question, switching from COVID. This is Heather Whaling. Mr. Mayor, thank you for making the time to be here. I think it's so helpful for all of us to get to hear your perspective and hear you talk about the equity agenda. The majority of people in Columbus don't necessarily have the chance to do these smaller, intimate conversations with you. And I think as I've been talking to some of the people who I know who have been out at the demonstrations or who have been concerned about some of the interactions between community and the police, there seems to be this thread or common theme of a lack of trust, especially among people who maybe in politics before, they don't understand necessarily the inner workings of government and how public policy is put together. What advice would you have for those of us so that we could be good ambassadors to help build or rebuild some of that trust within the community? But then also, what is the plan? What is the plan to help make sure those voices are being heard? I think right now they feel in a lot of ways that they're not being heard, which is, I think, why there's some continued ongoing demonstrations and calls for change.
Well, yeah, I appreciate the question. I've engaged with dozens of different groups that have been protesting and promoting change and reform, both virtually and in person. And we've made a significant amount of change. I won't tick through all the changes here for the sake of time, but some significant changes around independent investigation, signing on to the Obama pledge around measurement and reporting, the Safety Advisory Commission recommendations, putting forth the Civilian Review Board, which has been talked about in this community for decades, that we are actually going to put in place and seat by the end of the year. Continuing to hold officers accountable. We knew that a lot of people didn't feel comfortable and didn't have confidence in the Internal Affairs Bureau because it's part of the chain of command at the Division of Police. And so set up a separate place where independent investigations are going to be conducted administratively by Baker Hostetler, a law firm that handles a lot of different issues for the city of Columbus. And a retired FBI agent that is going to do criminal investigations based on police officers' actions during the protests that they felt not only were outside of the administrative purview, policies, procedures, training, but rose to criminal investigations. So I think there's a significant amount of change that's been made. We're just getting started. I mean, the only way you change, there is a cultural problem in the Division of Police. In the matrix, and this is not my thought, this is not my perspective, this is not my opinion, this is fact. And if you look at the matrix report, the recommendations and the recommendations of the Safety Advisory Commission, they all go after changing that culture within the Division of Police. And I think we have a roadmap to get it done. I'll be very clear and direct with you though. The FOP has zero interest in change. And it's why they have no credibility in our community. And that's why they are attacking individuals that are part of the change and reform that we're doing. That is why they are attacking the process. I mean, when you look at what police unions have done to undermine trust and confidence in law enforcement by communities they are sworn to protect and serve, it is stunning. And it is not unique to Columbus. But I'm not responsible for every place else. I'm responsible for Columbus. And so know that this is not going to be easy. Directly, I met with the FOP president. I said, if you pull the NRA trick and go to the four-corner offense and try to run out the clock to avoid dealing with these things, this community will hold you accountable. And that is exactly what we intend to do, to force the change and reform that the community is demanding. So I think two things specific to your question. We can share more information with you about the changes and reforms that have been made based on direct requests, direct meetings with protesters and engagement with protesters. I believe that we have a dashboard of the Safety Advisory Commission recommendations. I think 61% of the recommendations are already fully implemented or in process of being implemented. Share that dashboard with the group as well, but it's our job, and I take responsibility for improving communication with this commission and with the public about what's being done, how we're doing it, and how the public can be involved. You know, we chose a number of folks, council and the mayor, to serve on this chief's advisory panel that are going to help the chief change our policies and procedures to meet the community's expectations. And then obviously the Civilian Review Board working group that has been named that will help bring forth a Civilian Review Board that's going to work for Columbus based on best practices around the country. But there are going to be other ways for people to be involved as well.
Mayor Ginther, this is Gina again from Columbus Early Learning Centers. Again, also thank you for your time this morning. I think that for some of us who are part of this, the childcare conversation is definitely one that's important. And I think that it's a little bit of twofold right now. One, it's our future existence within our community because of funding, the restrictions, especially for organizations like mine who do support mostly low-income families and are highly subsidized by PFCC. There is a impending financial burden that we are really in the middle of at the moment. But I think the other crisis that is coming is in regards to the school year, and how organizations like ours and the YW and the YMCA, how we are going to kind of be looked at to fill the gaps for families with not additional financial support, without additional resources, and even licensed qualified teachers, because we're looking at a model where we're going to have to be teachers licensed professional school age teachers 3 days a week to try to help support families who are working. And I think the other big thing is that at what your level is with our city and our county and our state is needing people to say that you have trust in childcare organizations again, that we are following the rules and cleaning and keeping children safe. And I kind of don't want to say this out loud because I don't want to jinx us, but we, knock on wood, have been back for, over 7 weeks, more fully operating with 0 cases and not one single staff person that has been sick. So it is working if people are following what they're supposed to be doing. But I think that the trust has been eroded in any type of group care, that we need advocates in our community telling people that it's safe for children to go back to group care under the modifications. And because otherwise in a year, I don't know how many high quality providers you're going to have left, especially those that support the inner city and families who are low income and working class families.
It's a great point, and I'm glad you raised it. And it is something that I think I do need to do more of, is talking about the great success of our early childhood care centers, and all the incredible work that they're doing, all the additional steps they're taking to protect kiddos, their staff, and the families that are in their care. So I'm committed to doing that. I think you raise a good point, an interesting point, and that is what is our strategy for the short term, and then the part of the longer term, because I think the only way that centers are going to navigate this crisis and move forward together is through an increase in the PFCC reimbursement rate from the state. We are one of the lowest reimbursement rates of states around the country. And I think it's critically important that that's something else that we focus on. And maybe that's something that I ask for the commission's help with moving forward, is how can we become a lead advocate for that as a city, for both centers here, but childcare providers around the state, because I really do view that as the only way forward.
Okay, and I think one final question. Leah, I see you have your hand up.
Oh, thank you.
Yeah.
Thank you, Shelley. Thank you, Mr. Mayor. I guess I was going from a little bit different direction. One, you obviously, your equity agenda was announced in February. We weren't where we are today. So I guess, what did you think at that time it would look like? What were you wanting to achieve, and what were you seeing that drove you to make that bold statement at that point, even before we saw it lived out through these crises that we're living through right now? But you already had made that statement. And so what were you looking to do and achieve with that? And what were you looking for the administration to be able to move forward? You have representation on your cabinet, you have, a lot of proactive programming, but what were you looking to achieve and do differently in light of that commitment?
Well, it's a great question. And if I want to make sure I'm understanding the question, is what has changed with the equity agenda since I announced it in February? Is that the gist of the question?
A little bit of it, yeah, because it's now you're living out what you were trying to advance at that point. So where do you see, has it changed your thinking about it? How is there something new that you think is more imperative than when you made that statement in February? And how, again, are you looking to advance that
I would
at a
definitely,
systems level?
I would definitely say that that police reform obviously has been part of the equity agenda. I announced the comprehensive neighborhood safety strategy back in 2017 after a record year of homicides and issues of violence in the community. Part of that was the Community Safety Advisory Commission, the Matrix reporting, all those things. And that obviously has been a high priority. As I mentioned earlier, how many of the recommendations are already partially or fully implemented, and the changes we've made. I think certainly the protests and engagement with protesters has moved up and forced us in a positive way to change things more quickly around a number of the other things that I had mentioned, 8 Can't Wait, the Obama pledge, the change of use of pepper spray for nonviolent crowds, all those types of changes that we've already made, and holding officers accountable that may have been acting out of order, both legally and administratively, with independent investigations, having BCI outside the chain of command do investigations of death in custody or lethal use of force cases, never been done in the city's history. Those things are all moved up because of that engagement and response to protesters. So that part of the agenda obviously has become a top priority in the last couple of months. But to your point, affordable housing, the work of Celebrate One, continue to expand kindergarten readiness opportunities for young people. And clearly, when I announced the equity agenda, we weren't officially fully in the midst of a global pandemic that we find ourselves in now, with quite honestly higher confirmed cases daily now than any time during the pandemic. So I think on the public health and the public safety side, those have clearly become top priorities that may have been part of many priorities when I announced the equity agenda in February. They have become absolutely central and paramount. And I think critically important for us to address and acknowledge and work on before many people in the community will give us the credibility to work on some of the other things. That if we don't deal with health disparity and inequities, and the lack of trust and confidence in law enforcement, it's hard to have a conversation about expanding kindergarten readiness, preschool, reducing infant mortality, and expanding affordable housing. So, those are things that the community is demanding action on and movement on now that are part of our larger equity agenda. So I think that definitely is different than where we were in February.
And Barb Smoot, I know you were had something in the chat box, so we'll turn it to Barb for the final question this morning with Mayor.
Thank you. Mayor Ginther, thank you, number one, for being here with us today. I feel like I can honestly say that I don't envy being in your shoes and all the things that you have in front of you in terms of very complex situations to have to resolve. There's been discussion, a lot of discussion around process and trust. The reality is, as Black people and Black women have tried to trust the process in the past, it has not worked for them. And when you look at what's going on with pay equity for Black women in particular, it's getting worse. It was at July 31st, went to August 7th, went to August 13th. And we hear, Black women hear the message that, we got to be patient. Patience is a difficult thing for a community that is starving and not doing well. And tied to that has to do with the perception of relying on the large corporations and entities like the partnership to come to the table with solutions when that group is not diverse and not representative of any of these voices. You don't control the partnership, so we know that, if you can fix it today, I know that you would do it because you're that type of a person. And you juxtapose that with postings that are going out in social media from Jobs Ohio bragging about the 0% corporate tax rate in our community, while we have people who have no health care, poor school system or struggling school system, lack of jobs. What message would you have this group send to the community as we respond to those sorts of comments?
Well, I appreciate the question and the point. And Barbara, I think that after COVID, and I know Sue Ellen's going to talk about this, African American women's payday, equal payday may end up being even later after COVID-19. There's no group, I think, that has faced and will be facing continued economic fallout from COVID-19 like African American women. And so, I think that's something that we need to openly talk about and be prepared to talk about moving forward, and should guide, as we talk about recovery and resiliency, because that's really what I want to get to, Barb, is I think it would be very helpful to have at least one member of the Women's Commission and maybe more to serve on a recovery and resiliency advisory group that I'm forming to help us think about where we go from here. Because COVID, we have the public health crisis, we have the human service crisis, and then we have an economic recovery. But quite honestly, if we thought that the disparity was great before COVID, it's going to be even more significant, and the gap will be wider and deeper post-COVID unless we are very purposeful and intentional about inclusive recovery. And so, one of the things I think that has happened, but it's our job to keep the pressure on and the heat up on the private sector. I think there has been an awakening based on the number of corporate CEOs and higher ed leaders and others that have reached out to me around a civilian review board and some of these other criminal justice and police reform initiatives we're taking on, who want to get engaged, that know that they are not off the hook. And so I'm hearing more conversations in the private sector now about the fact that, what do their boards look like? What do their C-suites look like? What are their, but it's our job to hold them accountable and push them to make those changes. Not, again, don't study it and discuss it and acknowledge that it's a problem. Own the remedy and the solution to the problem. Certainly that is my charge as mayor on my side of things, and that is the charge and the oversight and accountability that we need to provide. The private sector, our nonprofit leaders clearly have to do a better job, and our funders. This is all information that's been pointed out and that we need to hold people accountable for. But that would be my message. It's not just the public sector and elected officials that need to be held accountable, but all of us, whether we're corporate CEOs, presidents of universities or colleges, leaders of nonprofit organizations, or leaders of philanthropic foundations.
Well, thank you all for the candidness, and Mayor for being with us this morning and sharing, listening. I'll be a conduit of all of the ideas that this is coming up with to be sharing with you and the members of our leadership team. So thank you for your time this morning, Mayor. A couple things, just a conversation around like workforce, schools. Just wanted to make sure each of you saw the invitation we put out last Friday. Heather Whaling had an idea as we were talking last week about how can we help support companies right now as families are understanding what the new school proposals are going to be in the fall. Now, working parents are having to make some potential tough decisions. Don't want to see happen is women dropping out of the workforce, women going part-time to try to handle the schooling aspect. How can companies be creative and flexible right now? And what are those ideas? So Heather has offered to help put together some listening next week on the 21st. If anyone didn't see the note or wants to be engaged, love to have representation from your companies in the conversation. The hope is to gather and put that, in a white paper, a quick reference list of ideas for companies to have at their going into August as their workforce dilemmas that are facing families. So, okay, with that, we are going to pivot now. I've had the opportunity to get to know Sue Ellen over the last couple of weeks. She is the new executive officer of the Center for Innovation. As Leah mentioned, in Mayor's delivered in February, racism as a public health issue, and the new. And so I thought it was an opportunity to know Sue Ellen, her epidemiologist background, and what she and her team are seeing right now as they are seeing the impact of residents. She has some things to share with us. We'll have a brief Q&A with her as well. And we are going to unmute Sue Ellen and make you able to share your screen. And I think we're going to unmute you. I think she's still muted. And we'll see if, are you there, Sue Ellen?
Yes, I am. Can you hear me?
Wonderful. Yes.
Good morning, everyone. Can you see my slides?
Yes.
Okay, great. First, I just want to say thank you so much for having me this morning. I had worked for the health department for many years, and I took a break for a few years to focus on my family. And this is when the Women's Commission started, and it was so exciting to me to see the focus and to have a mayor that's put a focus on women and pay equity and women's issues, and the First Lady and the work that she's doing. I wanted to talk to you today about inequities, the Center for Public Health Innovation, and the data that we have at the health department around COVID-19. So as we heard previously from Mayor Ginther, in the State of the City address in February, he, if I can get my slide here. There we go. Announced his equity agenda. He challenged the Health Commissioner, Dr. Mashika Roberts, to focus on racism as a public health crisis. And, this was before, as one of the, I forget who was asking questions about how has this changed the agenda, because this was already on the radar before everything has been exacerbated by the pandemic. And since that time, the Board of Health and Columbus City Council have declared racism as a public health crisis. And Dr. Mashika Roberts, in her response to the mayor, created the Center for Public Health Innovation. We are being tasked to develop recommendations for Mayor Ginther to address racism and health disparities by the end of the year. Our mission is to increase life expectancy, raise the quality of life by reducing health inequities that exist currently in Columbus. One of the things I do like to talk about is the difference between a disparity and an inequity. We often use them interchangeably, but they're really two different things. when we're talking about a disparity, it's just a difference that exists. An example I typically use is breast cancer. You know, more women get breast cancer than men. This is technically a disparity, but it's not an inequity, because this is something that it's biological. It's not a situation that we've created. It's not something that a person has a lot of control over, or society has a lot of control over. But when we look at an inequity, such as Black children have 6 times the rate of asthma of white children, that's an inequity, because we go down the line to find, okay, so they're exposed to more pollution. Well, why are they exposed to more pollution? Oh, let's see, they in communities of color, there's more industrial businesses, landfill, things like that. That was put together by decisions that have been made, right? These are inequities, are differences that are systemic, they're avoidable, and they're fundamentally unjust. So I just wanted to point out, a lot of our work is to focus on these inequities that exist. And when we look back over the more than 400 years history in this country of African Americans and the legacy of slavery and discrimination that continues to persist, African Americans and communities of color have been subjected to inequities that lead to shorter and less healthy lives. And if we're looking at what's happening right now during COVID, we are seeing that women and communities of color, and women of color in particular, are overrepresented, right? We're in this situation right now where women of color are particularly vulnerable. They are overrepresented in low-wage occupations. They're in the frontline workforce, not having as many options to work safely from home. They're bearing the brunt of the economic losses. And I know it was announced in June that, because many of the job losses have been to women in particular during the pandemic on a national scale. In June, they added about 1 out of 3 jobs that were lost, and many of them did go back to women because it was hiring at retail, hospitality, those kinds of jobs. Well, if we have a surge again, those will be the first jobs to go. And again, those are sort of high-risk frontline positions. And I think somebody had mentioned before, you know, we're continuing to have a wage gap where Black women in Ohio earn 63 cents on the dollar earned by a white male. Women of color continue to make up the largest share of people who experience homelessness. That, again, has been exacerbated during the pandemic. We've seen reproductive health services dwindle during pandemics across the country. And if we are looking at COVID in particular in our community, and this is just for City of Columbus, we've removed Worthington from this analysis. Our fabulous epidemiology unit here at Columbus Public Health put this together, and you can see that just looking at COVID by race and ethnicity, communities of color are bearing a disproportionate burden. So if I'm going across the top line here of cases and we compare it to the actual proportion in the population, right? So non-Hispanic Black people are 32% of the cases, even though they are only 29% of the population. Hispanic, 12% of the cases, but only 6% of the population. You know, these increases, these differences, these inequities are important to note. And in hospitalizations, we see it tick up for non-Hispanic Black residents of Columbus at 37% of hospitalizations. Now, in deaths, it's predominantly older white folk. We see most of our deaths are happening in the nursing homes here in Columbus. But what happens if we drill down a little more and we look at women by race and ethnicity? And again, we're going to see this difference. If we were to just look at gender only, you would see that, you know, women in the city of Columbus, we make up just over about a half of the population. That's about how we look for cases and hospitalizations. So you don't see the difference just looking by gender. But if we look at this intersection of identity of women by race and ethnicity, again, we see a serious inequity taking place, where 36% of our cases are to non-Hispanic Black women, despite the fact that they are 31% of the population. They are 40% of hospitalizations, again, 31% of the population. And if we look at Hispanic women for cases, it's 11% of cases, despite being 5% of the population, 8% of hospitalizations. So that's a really important thing to note. Now, as everyone has mentioned, and I'm sure you've heard many times before, this pandemic is highlighting inequities that have already existed, right? When we look at the fact that racial inequities by chronic diseases and other conditions that impact health have been leading to these poor health outcomes for communities of color. And I'm going to show you a slide from before the pandemic that this sets the stage. When we look at chronic conditions, you're going to see that you don't see a ton of difference by race for overweight, COPD, diabetes. Blood pressure is definitely significantly higher in communities of color. But the situation is that they got non-Hispanic Black communities die at higher rates. It's 2 times the rate of non-Hispanic white. So this is what the pandemic is building upon. And we know that these conditions already make people more vulnerable to COVID. But then we have to talk about the why. I've heard some people say things, oh, well, if people would just eat better, if they would just go to the grocery and buy a certain type of food. I hear a lot of victim blaming. This isn't really about personal choice. These are about structural inequities that have intentionally and unintentionally been put in place and maintained over time that leave communities of color more vulnerable to these illnesses and to mortality from these illnesses. And I'm going to walk you through a public health framework for reducing health inequity. This is adapted from a framework that the Bay Area Regional Health Inequities Initiative put together. So we often talk about these conditions that impact health or the social determinants of health. If we get back to the beginning, you know, I'm going to put you in this first box of social inequity. You know, we're really talking about the isms that impact with institutional inequities and how power and money and wealth are distributed in our society that then impact the resources that you have. And that breaks down into your living conditions. We always talk about where you live, learn, work, play play, and age, right, is so important to how your health is maintained. And then we get into some of the typical things we think about individual decision making. And of course, individual decision matters, but it doesn't take up a large proportion of it. What am I trying to say? It's not the main reason that you have a certain health outcome. It's not your individual decisions. That's a small percentage, right? It's these institutional inequities, the way power is distributed, and your access to opportunity in your community that frames your choices. Now, at the Center for Public Health Innovation, we have been around for 3 months. We've launched during a pandemic. We're very fortunate in that Dr. Roberts was able to rededicate close to 30 staff to the center. Our health equity section was moved to the center, as well as our chronic disease prevention section. And many of our staff right now are heavily involved in pandemic response, of course, but we are still trying to delve deeper into the issue of racism. You know, as people say, racism is real, but race is a social construct. And one of the first things that we did was to look for a national best practice. And where we ended up is with the Government Alliance on Race and Equity. And we have joined the partnership. There's probably about 280 jurisdictions around the country right now that have joined this alliance, that are committed to working on racism from a structural, institutional, and interpersonal levels. And part of the work is to obviously normalize the conversations about race. You know, how do we make sure that we all know and understand the language of a racial equity framework? Do we understand implicit, explicit bias, what individual, institutional, and structural racism is? Do we have a shared understanding? And to move forward, we need a shared understanding of those concepts, but we also need to be comfortable with how we talk about it. And I so appreciated during the mayor's State of the City address saying, hey, I'm going to talk about something that's uncomfortable. Talking about race can be challenging, but if we can't talk about it, we can't address racism. And we hope that the more comfortable we become, the easier it will be to take action. And this also gives us an opportunity to really prioritize this change and to act with the urgency that it deserves. And so part of our work is going to be educating internally and also working with our partners to create a shared understanding and shared framework and with the residents of the city of Columbus. And that gets into their second area of how do we organize, right? How do we build that internal capacity that I mentioned? How are we working with our partners? You know, we're very lucky, again, to be in a city where our leaders have prioritized racial equity. And while strong leadership is certainly critical, we also need to change from the ground up, right? We got to build that infrastructure. We got to create racial equity experts internally, externally, across all city departments and other institutions and within the community. And then the third piece is how do we operationalize it? As I mentioned, racial inequities, I mean, by definition, they're not random. They're not natural. They've been created intentionally and unintentionally and sustained over time, right? Government played a role in getting us here. Government's got to play a role in getting us out, right? We can't, it's not going to disappear on its own. And one of the tools that we're looking at is racial equity impact assessment, which I'll give you just a really brief overview in a moment. It's a tool that can be used to change policies and programs and practices that help to perpetuate inequities in our community. We also have to be data-driven, right? We got to standardize data collection. We've got to fill in data gaps. We need to have our data baselines. We got to set goals, monitor progress towards those goals, and measure policy and programmatic changes. And as with any process, you know, there's a continuous quality improvement part of it where you just kind of keep starting all over, hence their circle logo. So racial equity impact assessment, just quickly, it explicitly addresses how different racial and ethnic groups will likely be affected by a proposed action or decision beforehand. The goal is to try to anticipate what the positive and negative consequences might be, with a particular focus on how we minimize those unintended consequences. And it's a tool for preventing institutional racism and identifying new options to remedy inequity. You know, I think most of us are familiar with implicit bias or unconscious bias. You put that in a room with a group of people for collective decision making, and you arrive at institutional bias, right? And so this is a tool to put questions of racial equity explicitly in front of the group. It's best if we can do this early, right? I'll just give you a quick rundown, right? We figure out that desired result. It's a process and a product. It's iterative. You know, this is no magic wand. It's not going to just solve everything. We have to analyze the data. We need to engage with the community. In some instances, we can do a more rapid type of assessment where maybe we don't have a broad community engagement piece, because that's just frankly not always possible. But the bigger the policy or decision, the more people it's going to impact, the bigger the community engagement component should be. So as we're thinking through the decision, policy, or program, we got to look at what the data is telling us. We got to look at what the voices in the community are telling us. You know, they may see impacts that we're going to miss. As I mentioned, it can be small key informant interviews or a larger process. We got to look at who benefits, who's burdened, right? What are our mitigation strategies? How are we going to do it? You know, where are the data gaps? Are there regulatory issues, resource issues? And then, of course, we have to use all that data to evaluate the impacts. You know, did our mitigation strategies work as we anticipated? Did we make progress towards our goal? Is there something we need to change? And we need to disseminate those results, communicate those results with others in the community. And then basically the process starts over again. It's iterative, where we're constantly trying to figure out how to move the needle. You know, this is not something that's easy. There's a lot of interrelated factors, but we have to put racism and racial equity front and center in our decision making if we want to have an impact. And, you know, the goal, of course, is getting to racial equity. And how we know it will exist. It's when that social construct of race can no longer be used to predict life outcomes. And outcomes for all groups in our society will be improved by that process. So I'm happy to, that's a very quick, fast run through of sort of where we are at the center right now with our work and the charge that the mayor has given us, and a look at what's going on with COVID in our community. And I'm happy to answer any questions if you have them.
Thank you, Sue Ellen. And we will share these slides out. I thought it was helpful to see from the mayor's statement in February for the commissioners to see the progress that Dr. Roberts and you have been making over the last couple months. I think there's going to be some continued threads when Sue Ellen's team is continuing to pulse, the data, the epidemiologist lens of this. What's the impact of women in our community? How can we as a commission help support the efforts as well? So we have 20 minutes left, and I'm just kind of wrap into both, questions for Sue Ellen, but also, this larger question to the group over the next 20 minutes as you reflect on Sue Ellen's, very poignant data on COVID's impact on our population of people of color. You can just see the disparities that are showing in hospitalizations and deaths and case numbers. And then opening that up to, the earlier conversation with the mayor on, as each of you, what are you seeing and hearing from your colleagues, your friends, your neighbors, from women in our community? I know on the agenda, I put a whole bunch of questions on this section, not with the intent to get through all those questions, but more to show a framework of some additional conversations we'll be having over the next couple of months as we continue to evaluate and best understand how we as commissioners in this body of work can be impactful to our residents. So I'm just going to really open it up for conversation over the next 20 minutes.
Shelley, I don't think we have all the answers by any means, but I do know that anything that we can do to support flexibility, from a childcare perspective, we have a lot of parents who are trying to work full-time, childcare full-time. The stress of COVID, and then the stress of making choices of, do I send my kids back to daycare? How will I manage of a fluctuating school year? How will I manage even even high schoolers being at home all day by themselves, potentially if I go back to work? So I think anything that we can do to institute short-term flexible work practices, I think will serve us well in the short term and the long term. I mean, now's the time to sort of show up as the employers who can support our working mothers in particular.
And I think, this is Kate, Shelley, you and I have talked about this. I mean, I think for low income families, that's just even more exacerbated. And that folks are really having to make choices about going to work, paying the rent, or leaving kids home alone safely or unsafely, and educated or not educated. And so I know as an employer, we've certainly looked at flexibility, but for many of our clients, their jobs don't have that flexibility. If you're a cook, if you're a server, if you're a delivery person, you don't have another option about working from home or even control over your schedule in any real way. And so for our low-income families, I just think they're in sort of an impossible situation for this fall.
Hey, Shelley. Good morning. Sorry I had to join a little late. So if this was addressed in the mayor's comments, I apologize. But one of the major issues that we're sensing here in Columbus to be, quite the issue is in broadband access, especially with the Columbus City Schools. Could you help us with where the mayor or the city, or I'm just trying to figure out who owns this issue. I think there are a lot of people who are trying to solve for it, but I think the first 2 quarters, Columbus City Schools will be remote, and I read the horrifying statistics about how little people were able to access online learning, whether it was broadband, which I think is a big, or physically they just didn't have the hardware. What are we doing about that, or who owns that? I'm just confused.
Yeah, that question did come up earlier with their digital discovery and with schools. And so we'll start on that, Francie. We're continuing to work on those connectivity points internally in the administration, but we will get some more answers back to you.
Hi, Shelley. This is Ronnie. Good morning. I wanted to, first of all, thank the mayor and thank Shannon Ginther for their step. I also appreciate Sue Ellen's data and how she broke it down. That was very informative. And while we all consider everyone in our city and we consider all, shape, size, color, backgrounds, as we try to find ways to support our community as the Women's Commission, my concern, of course, is going to be we at the state level we have the Ohio Commission of Hispanic and Latino Affairs that's supporting, working closely with the governor's office to make sure that communications that are important with regards to COVID are being relayed to this specific population, especially women and children. I guess what organizations at the city level are out there, boots on the ground, trying to make sure, working closely with the Columbus mayor's office to make sure that these messages or brochures or PPE or whatever it is that specific community needs. I guess what organizations are out there, and is there anything that the commission can do to support what they're trying to achieve? Those are just my thoughts.
I'd like to second what Ronnie said. Good morning, everyone. This is Monica Sarazuela. Sue Ellen, thank you again for your presentation. I have not heard a lot over the last few months of people talking about specifically the Latinx community and how this is disproportionately impacting them. It wasn't until earlier this week, Sandra Lopez with Columbus City Council kind of called like an emergency meeting with some Latino leaders just to talk about how this is impacting the Latino community. And so again, like I don't know if this is necessarily directed to the mayor's office or just, overall, but, would like to see, to Ronnie's point, how are we really going into these communities and making sure the messages are resonating. From what I heard on Monday, that a lot of Latino-owned stores aren't implementing the mask requirement. Those in the Latinx community may go into a store with a mask, and then when they go into a Latino grocery store, they take it off. So want to make sure that, again, our messages are resonating with, the communities that are being disproportionately impacted.
I'd like to add to that too. Thank you. I appreciate those comments. There's so much involved in communication. Communication is so important. And the perception that the powers that be had, that people have the powers that be in the community. And let's take childcare, for example. The perception, and there's, this is not to say this is true or not, but the power of perception, that you have a group of well-to-do individuals who all have nannies trying to figure out how to resolve the issue of a Black single female-headed household, Latino, a single head of household who is on an hourly employee. If we are not communicating over and over again and broadly and making sure that we are connected with the Lily Kavanaughs of the community to make sure that those messages are getting out there, that, that we're working on it or what we're doing, it exacerbates the frustration that people feel that they're not being heard and their cries aren't being heard for help and assistance. Don't let the good work that is being done get missed for lack of communicating it to enough people. and finding the right channels to get it out. And it's two-way communication, because those individuals will also come to the table with phenomenal ideas. You know, again, the perception that Columbus faces is that ideas are only accepted but from people who are from large corporations who have big, powerful jobs, and it's their ideas that are heard and considered the best when they don't met the people, don't necessarily walk in the shoes of the woman standing at the bus trying to catch her bus to get to work.
Mhm.
When we the stuff around evictions and everything, oh my gosh, phenomenal stuff. Is that the results of that work getting out to the people who need to hear it and know that it's out there and it's being worked on? A sense of hope.
Jillian, I think I saw your hand raised. Sure.
Yeah, I wanted to follow up just on Kate's point about essential staff. As an employer, an agency that has staff that had to work throughout and work with the highly vulnerable population, you know, there's a prediction by some mental health experts that there's another crisis waiting for us kind of at the end of 2020, and it's about staff burnout and potentially employee absenteeism related to mental health issues, just from having to deal with this. And as has been mentioned, you know, not having choice and not having flexibility and options in their work schedule. So just wanted to offer that as we consider different recommendations or, you know, how to help employers continue to navigate this crisis, that we think through or, you know, bend the ear of experts on this, how employers can offer mental health support in real time so that they're addressing not just the physical safety of their staff, but also the psychological safety. And so I don't know if that looks like, you know, consulting with mental health professionals, bringing them on site, you know, reaching out to your staff, asking what support would look like. You know, I just don't want to miss that, because I definitely see the burnout and the stress in the staff at the Y that has not been able to take a break at all.
Thank you for that comment. Just an anecdotal thing to share around the worker burnout and stress. A lot of companies are saying that their productivity has increased actually since employees are working from home, and they don't understand or connect the dots that the reason for that a lot of times is because they're not taking care of family. They're so scared of losing their jobs. They're working ridiculous hours to prove that they're working online, you know, so while their home life falls apart and they're under so much stress, by golly, they're going to do whatever they can to deliver at work because that's what's feeding their family. So thank you for that comment.
This is Denise. Denise Robinson Alvis. I just wanted to make a comment. And I was thinking about something Barb said about the communication piece, because I think that is really, really important for us at this juncture. But I also think that the Women's Commission has done some incredible work around evictions. We worked so hard, and before me and then after me, we've been continuing to work with the adopters and the employers. And I think that that's an opportunity for us, an incredible opportunity for us to do more of that communication piece to get some of this word out. But also on the other side of human service organizations, we're facing this every day. Every day we have women that are coming to us that are our clients that come through all of our organizations, and we have to be ready to answer these questions, and we have to be able to point them in the right direction. We have to be able to arm them with what they need to succeed. In my organization, my women and their kids, and we said it earlier, where about 1/3 of them didn't even have the Chromebooks. And then I recently got the CIO from Columbus Public Schools is on my board, and she personally walked over Chromebooks for folks. And I just think the communication piece is lacking. I just think that we have to do a better job of communicating.
I agree with Denise's comments. I think one of the things we've done really well is, again, being a newer board member, and I saw how the commission was so intentional around the Columbus commitment, and I think that we're talking about systems level changes that are needed. I was, on the chat with Barbara talking about this. It was like, again, as a housing organization, I'm all for more funds for housing, more funds to do what we do, but programs isn't going to get us out of this. Our programs have been responding to the systems that exist for generations. So what are we doing to change those systems and to advance a different way of thinking at leadership levels? And I think that's part of what was able to happen with the Columbus Commission commitment, was you changed how people thought about women in the workforce and how women should be paid, and why is there this inequality? And okay, wait, we can do something about it. How do we, create a similar model around the systemic racism that we see that is then causing these effects that we're responding to in the community? And so, I would love to, some thinking around that as it advances all of our women. It's going to support, of course, women of color, the women of a lot of different races, as well as advance our community. So I think that systems level thinking that the commission has brought, some of that has resulted in programs, but it didn't start with the programs necessarily. It started with, how do we change the conversation, and again, pull in those corporate partners that we know have influence. I've been, if any of you have been watching this whole Washington Redskins thing, the owner of that team, he did not get a revelation overnight that he was going to change the name of his team. He was pretty adamant that he wasn't going to do that. Well, FedEx had something to say about that, as had the naming rights for that stadium. So you have these ripple effects from corporate partners that actually can get change to happen in the communities in the ways that we want to see.
Shelley, may I make a comment?
Absolutely.
Good morning, everyone. I kind of wanted just to underscore the comments just made by Leah, in part because there's a lot of conversation around reaching the community and educating the community. But I want to continue to reiterate the importance of folks like us educating our corporate partners in the necessity for them to step up in this space and in this moment. And that's exactly what this body did a year or so ago, which was so impactful, as Leah stated. I think, there's a couple of campaigns going on around the country, notably Pull Up for Change, really taking corporations at their word around diversity and inclusion and what that looks like for their companies, for their employees, for their C-suites, and the folks that are part of their board. And we have partners, corporate partners in our community that they have a diversity statement, and that's about as far as it goes. And so I think that there's nothing wrong with stressing the importance of pushing this needle forward, not just with the work in our communities, but reiterating the need for our corporate partners to step up in a major way to assist in the work that we're individually and collectively trying to do in this moment. We cannot do it alone. And Leah's absolutely right. There's not going to be enough programming to right these wrongs. And then I admittedly believe that it should not be programming that fix these systematic issues. So, you know, I have a lot of thoughts on this conversation, and I'm trying to taper myself back a little bit. But I think that it's time to start to add that pressure to some degree. I don't know what that looks like. I don't know if it's a pull up for change type of campaign. But I know that if we don't ask, if we don't demand, if we don't start to highlight in major ways, it's very easy for people to check out and to say that, you know, they've got a diversity and inclusion group. It's robust, but it does nothing in regards to leadership. And we know if you don't have the appropriate diversity, the appropriate folks at the table, there's not going to be the type of aha moments that we need to really bring about the type of changes that this group wants to facilitate in Columbus.
Councilwoman Favor, thank you so much. You know, my day job is in the trenches and trying to work with corporations to move the needle. And, you know, and I have lots to say too, but I'm gonna temper myself. Getting the attention, getting the response, having them view it as a sense of urgency, and my not being important enough because I'm not a CEO at one of the big companies. You know, will they listen to the words that I have to share? There is a big sense of frustration with the lack of diversity in corporations here in Columbus, and the lack of diversity of, you know, the Columbus Partnership and a lot of the other bodies. But, you know, again, I'll temper what it is I have to say. We will not, to Leah's point, get ourselves out of this through programs. It's just not going to happen. It's a systemic change, public sector, private sector, nonprofit sector.
And I recognize we were already at 10 o'clock. And I think the conversation could go on for more, and I want to be respectful of everyone's time. So a few thoughts. Thank you for, again, the conversation. I know we had originally had full commission meetings every quarter. I'm feeling the opportunity to pull us back together, maybe in 4 or 6 weeks, for those that are able to join another call like this, where it's the conversation and the dialogue of what we're seeing and feeling and where our opportunity is. So let me kind of noodle on that with a couple others and maybe put some other opportunities out for conversation in this way. As we mentioned before, we're doing some working groups next Tuesday. So welcome any engagement if you'd like to participate in those. And I did send out in like a report, I think it was after, it's part of the calendar invite. So take a look at that. I really tried to capture some of the new resources that we have. We do have a resource for employers we're going to be putting out around policies around COVID, how they can support their employees, and a couple other pieces that will be coming out soon, a couple other events that are coming up. Everything's kind of optional on the event side. They're all virtual. I'll let you know if there's anything more like mandatory I need your presence at. So be sure you take a look at some of the things that are happening in the next couple of weeks there. Any questions anyone has? Anything else anyone's sitting with as we kind of wrap this up? It is so good to see all your faces and hear your voices. Shannon, I'll see if there's anything else you want to add as we wrap up this morning.
Thank you to all of you for taking the time, and really great conversation. Some thoughts came up for me around what type of national campaigns we might sign on to as a city that will help apply pressure in the right ways and places to move the conversation specifically around pay equity for white and Black and brown populations here in Central Ohio. I think that we could definitely do some more work there. And thanks again to Sue Ellen for the information on COVID. It's always striking, makes me mad every time I see it. So thank you, and have a great rest of your day and your week.
All right. Thanks, everyone.